things that you are doing in the community, but to really talk about COVID education and vaccine rollout. We know that our society, our media has been bombarded with information. And I must just pause and say that all information is not true. And we want to debunk some myths today. We want to make sure that you have proper information. And we want to make sure that you are getting that information from trusted sources. Secours is led by the market president, Matt Caldwell, and I am grateful that he is with us today. And I know that his schedule is so busy, but I'm grateful that he has taken time out to be with us on today. I want to thank everyone for being on, and I'll give some closing remarks at the end. But we want to let everyone, or ask everyone, to please, if you can, keep yourselves muted. And if you have any questions that you would like to present, if you would please place those in the chat section. After our presenter, we will have opportunity to go to the chat box and read off those questions and allow our guests to comment or give proper information along with the support staff of Secours and be able to give you the proper information. We also would ask that in order that we can keep the bandwidth open, that you will keep your cameras off if possible, unless you just want us to see your smiling face. But we would ask that you would keep your cameras off. It really does help with the bandwidth and to help things run smoothly. We'll have a welcome in just a moment by Matt Caldwell. But before we turn it over to Matt, I want to thank all of our faith leaders that are on right now. On our private Zoom, we have a number of people, but then on our Facebook Live, we have people tuning in as well. And on behalf of myself, President Fleming from the NAACP, and Secours, we just want to say thank you. Matt, I'm going to turn it over to you. And I want you to know, Matt, you have pastors from all over. You have Greenville represented. You have Easley represented. You even have some pastors from Anderson County represented on this call today. And so we're just grateful for all of our faith leaders, but most of all, we're grateful for Secours and all of the great things that you all are doing. And even though people live in different areas, we know that your touch is all over. So thank you so very much. After Matt, we will turn it over to Deb Long, and she will introduce our speaker for today. Matt.
Well, very good, Pastor Dogan. Thank you so very much for that intro, and so honored to be welcomed into this group, and just can't tell you what a privilege it is to be here. But I'd also like to tell you about the privilege it is to work with Miss Deb. I've worked with Miss Deb now for about 2 years, and her team and what she's been doing for all the years, but then also specifically in the pandemic and making sure people are trying to get registered for the vaccine. I'm just so appreciative of that and appreciative of who I work with. And I will pass it off to her, but I wanted to let y'all know that the faith-based organizations that have come to the forefront during the pandemic blesses my heart every time. And I just got a call here recently, and I can't thank y'all enough for what you've done for our community and for our patients. And we are continuing to try to pursue our mission, which is extend the healing ministry of Christ and being the hands and feet. And it really is a focus toward the underserved. And so with that, I'll pass it to Deb. But thank you so much, Pastor Dogan, for allowing me to join you. And Miss Deb, I will give it to you.
Thanks, Matt. Appreciate it. Hello, everybody. This is Deb Long from Secours, St. Francis. Thank you for coming and listening and participating. It's going to get really, really good. We're going to have a presentation by Gervelle Fort, and I'll share a little bit of information with you about her in just a moment. And then we'll have time for questions and answers so that you can get involved and have any questions answered by our experts. So at this point, I'm going to share with you the speaker is Jervelle Fort, and she works for the Community Systems Team at South Carolina Dhec as a health educator, in which she provides technical assistance and resources to communities to promote healthy eating and healthy environmental changes and active living. That stands for HEAL, HEAL. She served in this role for 3 years, and recently she became a COVID testing site consultant. She holds a bachelor's degree in community health and a master's degree in public health. She's a certified health education specialist and a child passenger safety certified as well. So Ms. Jervelle is going to come forward and she's going to make a presentation. And if you hear anything during the presentation, we are going to keep look over the chat room. So the chat room should be below you at the bottom of your screen, and it says chat, C-H-A-T. You can just click on that. If you're at a computer, go right into the chat, indicate what your comment or your question is, and I'll keep track of those so that we can have Ms. Jervelle respond to them, or whoever else it applies to. All righty. Ms. Jervelle, are you ready?
I am ready as I'm going to be.
Wonderful. I turn it over to you. Thank you.
All right. Good afternoon, ladies and gentlemen. And Deb, thank you for that wonderful introduction. As it was said, I am a health educator for Dhec. And before I get into the presentation, I just kind of want to let you all know some of the things that I do on a regular basis outside of COVID. I can connect you with a bunch of different resources as it relates to healthy eating and active living. One of my favorite things to do is work within the faith-based community to, like I say, help connect with resources, to help jumpstart health ministries and things like that. I have a plethora of just general health education information in my office, and I'm good at coming up with different ideas for the congregation. So I say all of that to say, after this, if you need me for anything else, please call me, because this is what I do. I will keep my camera off for the presentation, but I'll turn it back on during the question and answer portion so it can be a little more personable. And feel free to ask me anything you want to ask me. If you have a question that I do not have an answer for, I definitely will go out and get the answer and get back with you. So let me share my screen. All right, there we go. So I know that we have all been inundated with a plethora of information about what COVID is, but I just wanted to give a brief refresher because a lot of times we get tired and we forget why it is that we're doing what we're doing. So with COVID, it is a respiratory illness that can lead to chronic conditions and pneumonia. It is spread through the air by coughing and sneezing, close personal contact, such as touching or shaking hands, and touching an object or a surface with the virus on it, and then touching your mouth, your nose, your eyes, your mucous membranes. Some of the most common symptoms of COVID are fever, cough, shortness of breath, and of course, the loss of taste and smell. COVID is preventable if you wash your hands often, avoid touching your eyes, nose, and mouth with unwashed hands, avoid contact with sick people. Please stay home if you are sick, and covering your mouth and nose with a tissue or sleeve when you're coughing or sneezing. And adding to that, make sure you wear your mask and also getting the vaccine. I do continue to encourage people to be tested because you can be asymptomatic, and we do not want you walking around spreading this virus and not know it. So this is one of my favorite slides because it shows how important wearing a mask is. If you look at the bottom, you see the two people interacting that both have on their masks. The transmission probability of COVID is 1.5%. So I just encourage people to continue to wear your mask covering both your nose and your mouth. And if you are traveling or you are in a place with a bunch of people, wear some sunglasses. You can get a face shield off Amazon, because I have definitely done that, but you want to protect yourself at all costs. So right now, Dhec's top priority is to make sure everyone receives the vaccine. But because doses of the vaccine are limited right now, we're doing a phased approach. And we are currently still in phase 1A, and that should last throughout the end of this month. This phase contains people such as healthcare workers, residents and staff of long-term care facilities, anyone aged 65 and older, anyone aged 70 or older, public health workers who frequently interact with persons potentially infected with COVID, and home caregivers for children who have special medical issues, such as their child who has a trach. These phases are constantly changing. So you may be in phase 1B today, and tomorrow you may be in phase 1A. So I encourage you to just keep up with the news and continue to go to the Dhec website to see what's going on with these phases. There is a very comprehensive list of the phases on the Dhec website. So if you go and you want very detailed information about that, I encourage you to do that. So how do the vaccines work? There are 2 approved vaccines that are available right now, and that's Pfizer and Moderna. Both of these vaccines use the same method to protect you from COVID and have similar information. Currently in South Carolina, you are most likely to receive the Pfizer vaccine. However, Dhec has been issuing Moderna. If you do choose to get vaccinated, whatever you receive for your first dose is what you should receive for your second dose. There are currently no studies on mixing vaccines, and I do not want one of you to end up being the guinea pig to see what happens if you do that. While some of the vaccines use a weakened version of a virus or a part of the actual virus to teach your immune system how to recognize it, both Pfizer and Moderna take advantage of state-of-the-art technology that uses a fragment of mRNA that provides instructions for your body to create antibodies for protection. And I will talk more about that later on in the presentation. But this way, if you are infected, you will already have the antibodies ready to fight off the virus. If you become infected with COVID and you have not been vaccinated, your body would take more time to develop these antibodies, and the virus will actually take over your body, and it will be a whole lot worse. Because the vaccines do not contain a part of the actual virus, they cannot give you COVID-19. And I always tell people when I'm teaching about any vaccine, taking a vaccine does not mean you won't get the virus. It just increases your chances of survival. So I know a lot of people are concerned about the side effects. Again, the vaccine will not give you COVID, but that does not mean you are going to feel great after getting vaccinated. With any vaccine or medication, you may experience some side effects. The most common side effects with this vaccine are pain at the injection site, sore arm, fatigue, headache, low-grade fever, body aches, and diarrhea. These are all signs that your immune system is actually responding to the vaccine, and they will go away within a couple of days. Side effects appear to be more common after the second dose, particularly with the Pfizer vaccine. I know this slide is a tad overwhelming, but it addresses Pfizer's phase 3 clinical trial data on the side effects. And if you look, roughly in about 8 to 10 people reported pain at the injection site of the side effects. Any side effect that was observed in at least 10% of participants is marked in yellow. So my personal vaccine story, because I have been fully vaccinated, I took my first dose back in January, and the only issues that I had was pain in my arm, and it was sore for a couple of days. I developed a little knot. It was red, but it went away within about 48 hours, and that was it. With my second dose, I literally felt the vaccine moving through my arm, and I'm like, oh, okay, well, at least my body is responding to it. Ended up taking my boss to lunch that day. And I got home about 5:30 because we left work early. I slept from the time I got home till about 11 o'clock, got up, did a little bit, went back to sleep, and slept till about 10:30 the next day, which is rare for me because I'm not that person that sleeps all day. I did a little bit on and off that next day because I had to work. And luckily I was working from home because I kept falling in and out of sleep. And that happened the entire day. So all of that happened on Thursday and Friday. Saturday, I slept for most of the day, but that Saturday evening, I was fine. And that Sunday, I was fine. So the way my body reacted was to just make me sleep. I did have soreness in my arm for a couple of days. It was red. There was an actual knot in my arm, but like I said, all of that went away. And these symptoms, everybody's body responds differently, but it's nothing that should deter you from getting the vaccine. It's nothing that major. If you do experience side effects after getting the vaccine, you can easily manage these symptoms. Pain at the injection site, you can use a cold pack or take an ibuprofen. Some experts say not to take pain relievers before you get the vaccine because it may diminish your immune response, but that's completely up to you. I suggest getting your injection in your dominant arm since you move it and use it more frequently because that will help with the pain and swelling. And you can also take an ibuprofen if you experience a low-grade fever. Like I said, with the knot in my arm, it will go away. My masseuse actually massaged it out for me, so I have not had any issues since. Be sure to stay hydrated and give yourself time to rest after the vaccine. If your body responds like mine, you won't have a choice and you will be asleep all day anyway. So just kind of keep that in mind. So what is in the vaccines? Pfizer and Moderna are very similar, so their ingredients are very similar. And you can actually find the specific ingredients to the vaccine on the CDC or the Dhec website. mRNA is the active ingredient in both vaccines, and that is a genetic material that provides instructions for your cells to make proteins. So what scientists have done was create a synthetic mRNA that recognizes the little spikes that you see on the pictures of the coronavirus. And that teaches your body to recognize the coronavirus as an invader and produces the antibodies against it. mRNA is not able to enter the nucleus and it degrades once it's in the cell, so it can't hang around to cause any long-term effects. And it does not change your DNA because I know I've seen a lot of people saying that on social media. Neither Pfizer or Moderna use stem cells from aborted fetuses because I know that has been a big issue with some people as well. So with vaccine development, normally vaccines take years to develop and test and be approved for public use. But with this one, I want you to kind of keep in mind that we have greater technologies than we did in the past and even more than we did just a decade ago. COVID created a worldwide common effort. So we had more scientists, more minds, more people working towards this vaccine development. And there was a strong driving force, plenty of funding, plenty of testing that went into this. And also, it wasn't like we had to create this vaccine from square one. Coronavirus itself is nothing new. We have had outbreaks of coronavirus in the past, just under different names because of different variants. So if you remember when we had the SARS outbreak back in 2003 and MERS back in 2012, these are also variants of coronavirus. So scientists were able to take what they knew about these and create the vaccine that we are using now for COVID-19. Both of these vaccines have been and will continue to be tested in large clinical trials to make sure they meet safety standards and to see how they protect people of different ages, races, and ethnicities. So a lot of people have wondered if I've already had COVID, can I or should I still get the vaccine? And the answer is yes. While actually having COVID will produce a natural immunity, the vaccine is designed to trigger an immune response that will provide longer lasting protection. So if you have had COVID-19, you are required to wait 90 days after infection to receive the vaccine. And just for anybody, you are required to wait 14 days after receiving any other vaccines that you may choose to get before receiving the COVID vaccine. Data suggests that reinfection is rare within 90 days of your initial infection. But do remember, just because you have had COVID does not mean you can't get it again. You may have some natural immunity to it, but you definitely can be reinfected. So for now, Moderna and Pfizer require 2 shots. The first is to help your body recognize the virus, and the second is to strengthen that immune response. For the Pfizer vaccine, clinical trials showed a 52% efficacy within 12 days after the first dose, and a 95% efficacy within 7 days after the second dose. For Moderna, clinical trials show 70% efficacy within 28 days after the first dose, and a 94% efficacy within 14 days after the second dose. And I just want you all to keep in mind, too, that the fact that these vaccines have a 95 and 94% efficacy is major, because this is a higher level of protection than some of the other vaccines that we take, such as the flu and shingles, which is only about maybe 50, 60%, if that. Not all COVID-19 vaccine candidates require 2 doses. Johnson & Johnson only requires 1 dose and should be receiving FDA emergency use approval within the coming weeks. Scientists don't necessarily know how long that a 1-dose shot will protect you, but I've seen a lot of articles here recently, even yesterday, about how well that this vaccine is doing in people. So you should be hearing more about that soon. And this slide, I just decided to add the other day because I know a lot of people have said that herd immunity is our only way out of this pandemic. And there is some truth to that. So herd immunity happens when enough people are protected from a disease because they've had the disease or they've been vaccinated. So with herd immunity, yes, it is important that we get exposed to it so we can fight it off, so we can build up that immunity, and we will stop catching it at the rates that we are catching it and dying at the rate we are dying. But at the same time, you don't want to risk losing thousands of lives every single day just so we can build up this immunity in the community. So it's best to get vaccinated so we can just give humanity a fighting chance, because at the rate we're going, we are losing. So what about the variants? Viruses are constantly changing through mutation, and new variants are expected. A mutation is a change in the virus's genetic sequence, and a variant is a form of the virus that differs from the standard type. So the main variants of COVID right now that I know you've heard about are in the UK, South Africa, and Brazil. Again, viruses are constantly changing and mutating. However, not every mutation is advantageous to the virus, nor does it make it more infectious or severe. Scientists are currently studying how these authorized vaccines are going to recognize the variants and give us protection. It is true that the vaccine may be a little less effective on these new variants. However, that does not mean that they are useless. Anything is better than nothing. Just like when you're wearing your mask, anything is better than nothing at all. So this slide gives you a visual of how a vaccine can still be effective against a variant depending upon mutation. So if you think of the vaccine like an oven mitt, you put it on your hand, it slides right on your fingers, it binds, it fits, and it offers you protection. If you slightly bend your fingers, the oven mitt will do the same thing. It has a pretty good fit, maybe not as snug of a fit as before, but it still offers protection. If you ball your fist up, that oven mitt still offers some sort of protection, but it's not nearly what it would have been. So again, that just kind of shows something is better than nothing at all. So this slide is all of the contact information you will need for any of your COVID questions, for your appointments, or anything. If you don't have a question for me right now and you think later on this evening, I wonder this, that, and the third about the vaccine, call the Dhec vaccine information line or even the Dhec care line. Staff are available from 7 a.m. to 7 p.m. daily, and they can help you with any of those questions and also talk to you about some of the other services that Dhec as a whole offers. If you would like to schedule an appointment at Dhec, call the Upstate appointment line. We do have an appointment line that is good for the entire state of South Carolina, but all they're really going to do is just connect you with the appointment line for your specific region. And I can drop that in the chat box if anyone's interested in sharing that. So if you decide that you don't want to get vaccinated through Dhec, that is perfectly fine. Still go to the Dhec website and go to Vax Locator, and it will show you who has the vaccine, if there are any appointments available, and you can do everything from there. You can go to Prisma, CVS, Ingalls, Publix, any major hospital system. All of that information will be there. And I have been telling people, and don't tell my coworkers that I said this, but if you are having any trouble getting an appointment or having somebody answer the phone or just any trouble on the website, period, just pop up at one of the health departments and say, hey, I want to schedule an appointment. I need help. Do this for me. And they will do it. So Dhec has been experimenting with different mobile vaccination clinics. And I do cover Lawrence County and do backup for Greenville, so I can speak a lot about Lawrence County. At the Lawrence County Health Department, we do have a mobile vaccination clinic where you make your appointment, you come, get in line, you get vaccinated, you wait your 15 minutes for them to monitor you to make sure you don't have any reactions, and you go on about your day. There are also other mobile clinics throughout the upstate, and there is one that is coming very soon at Buck Mickle, the old McAllister Square parking lot. I actually saw them setting up the tents yesterday, so that really excited me. So just kind of keep calling, keep going to the website to see, where you can get in with all of that. I do know that it's not the most ideal situation with everything that has been going on, but you can go to the old Kmart to get vaccinated through Prisma. I think now you're having to make an appointment if it's your first dose, but you can just walk in if it's your second dose. And Prisma has actually just rolled out their mobile vaccination bus. I'm not exactly sure how that is working right now, but I do know their intention is to go in to the communities and vaccinate those people who can't get out and about to go and receive that vaccine. And maybe somebody else on this call has more information about that than I do. I do, again, continue to tell people, get tested, because it's better to be positive that you are negative. If you do decide to get tested through Dhec, we do have many mobile testing sites. You just drive through, get tested, go on about your day. Everything is free. If you are missing your test results and it has been more than 3 days, there is a email address down here. Email them and let them know, and they should be able to help you.
Okay, thank you so much, Javelle.
Wait a minute. Now I got just a little piece more.
Okay, all right. Just want to let you know some questions are coming.
Okay, good. So yes, I am definitely coming to the end. I wanted to throw into that if you need any COVID information for your congregation, for your organization, I have plenty. I have things like COVID and your mental health, how and why you should wear a mask, how long COVID lives on different surfaces. I have coloring books to explain COVID to children. So if you want any of that information, contact me. If you would like your church to be a testing site or a possible vaccination site, please let me know as well. And if you have anything else that you would like for me to help you with, call me, email me, send me a smoke signal, something, and I will be there to help you. So that is it. Now I'm available for questions.
Thank you, Javelle. That was an excellent presentation. There is a question in the chat box. Are there any plans to make the mobile units available in the rural Black communities?
So there are plans to make the mobile unit available in the Black community. We actually had a conversation about a week ago on how that's going to take place. So I think right now what Prisma is doing is trying to locate the different communities that need this mobile vaccination unit the most, and working through Dhec, because I do work in the community. That's my whole job. So if we can kind of work together to figure that out, that should be happening sometime very soon.
Great, thank you. What about those who are homebound in terms of getting a shot?
So for those who are homebound, I do know that if you call, and then you're going to have to actually call to make an appointment. This is something that I know you cannot do online, and let these people know that, hey, I'm homebound. I can't get out. I need somebody to come to me. I do know some people have been actually going out and giving people these shots in their homes, but you just have to call and express that to these people, to the vaccine team.
And the vaccine team is, you talking about Dhec's vaccine
I am
team?
talking about Dhec. Yes.
Great. Here's another question. If you are a caretaker, can you get vaccinated along with the individual?
So they say no. However, if you go, and I can just speak for the Lawrence County Health Department in particular, if you go and you are bringing the person who you are taking care of with you, and you express to them, hey, I want to be vaccinated so I can be my best self and protect the loved one that I'm taking care of, I'm pretty sure they will do it, because I know that they have done it here in Lawrence County. So I say, go for it. Ask them.
Great, thank you for that. There aren't any other questions that have come by chat, so we can open it up to the audience. Does anyone have a question or a comment they want to make? And I think the tech team would need to take you off of mute.
Yes, I have a question. First of all, thank you, Ms. Fort. Awesome presentation. We greatly appreciate it. Reverend Artis Buford representing the Easley community. What about the unused vaccines? It's my understanding that once they have been prepared for use, that they are not able to be preserved for an extended amount of time, especially those that require certain temperatures of refrigeration. Are there any plans as it pertains to if the persons who were scheduled to be vaccinated that day, if there's a difference between the number who showed up and the number of vaccines that are still available, that those unused vaccines would then be made available at the end of each day or term for others who might not have previously signed up?
So what I have been telling people with that, especially if you are not in the current phase, and just even going back to somebody who is the caregiver of somebody, call one of the local health departments and tell them that you would like to be placed on a waiting list, and they will know what you're talking about. So at the end of the day, if there are any unused vaccines, because we definitely don't want to throw them away, definitely don't want them to go to waste, they will call people in to say, hey, your name came up. Are you able to come in and get your vaccine today? But with that, they will still prioritize those who are in phase 1A. So let's say you put your name on the list, and somebody who is 80 years old calls in and says, hey, I want to get the vaccine. They're going to prioritize that person over you. But just keep trying, and this happens on a daily basis. So it's not like there's this long, extensive waiting list that goes on throughout the day. It's like it's thrown out at the end of the day.
Thank you. We've had a couple more chat questions come in. Who can a health agency contact to be able to administer the vaccine?
You would need to contact Dhec, and if you actually would give me the information, I can go through my supervisor for that, so it can be a little less stressful, and we can get answer quicker.
This question came from Russell. We need a last name and contact information, a phone number. All righty, the next question: for people who have gotten the shot and have had COVID and it was not within the 90 days, there's something to worry about?
No, it's nothing to worry about. It's nothing to worry about at all.
Okay, I'm just making sure I read that right. Okay. And then the other question is, will there have to be a booster in the future?
We are not sure if there's going to have to be a booster in the future. Right now, they're not looking into that, but you never know.
Okay. A couple more chat questions. Are all age groups able to get the vaccine now? I was told the vaccinations are only for age 70 and up right now.
Yes. So not all age groups, only those 65 and older, 70 and older are the ones who are able to get the vaccine right now. But it just kind of depends too on your line of work. And, if a certain circumstance, if you are on this wait list and you are called, that kind of may be God's way of sliding you in there. But as for right now, those who are eligible and prioritized are those 65 and older, 70 and older.
Thank you. Here's another chat question. Have you experienced fear and confusion in the African American community? Have they felt supported through your efforts?
So I've definitely experienced a lot of fear and confusion. And even yesterday, I had a conversation with several women where they were expressing to me how apprehensive they are about taking the vaccine and their reasons why. And I definitely understand, especially in the African American community. I get it. But I found that it makes it better when me being an African American female goes into an African American community and sharing with them my experience, because a lot of times we want people to come in to talk to us that look like us. And it makes a difference. And it makes a difference when this person that's talking to you has actually experienced what you are afraid of and can share their experience and say, hey, I did this, everything is going to be all right. Even just yesterday, like I said, I was speaking with these women and this woman was really upset and scared and just expressed all of her concerns about the vaccine. But after talking with her, reassuring her and sharing my experience with her, she said that, she was definitely going to pray about it, because I told her to do that before anything else, because I did the same thing. But she said that, she was leaning more towards going to get it just from having talked to somebody who had been through it.
Thank you. Here's another one. When do you think phase 1B will start?
It will probably start at some point in March.
Okay. And would you identify who's in the 1B category?
Yes, I actually have that written down somewhere. Hold on just a moment. Okay, so phase 1B are firefighters, law enforcement workers, USPS workers, teachers, etc. And like I said, it just kind of depends, because I know some teachers that have already been vaccinated in phase 1A. I know some law enforcement workers who've been vaccinated in phase 1A. So, I mean, it just kind of depends. But that's kind of phase 1B for right now.
A follow-up question. When will the vaccination be available for 50 and up, age 50 and up?
I am not sure, but I can look and get back with you.
Okay. And if Reverend Bates Scott would give us a contact information, email address, we'll get that answer to you. Are there any additional questions from the audience?
Yes, I was couldn't get in my chat question. This is Pastor Clark, and I wonder if Ms. Ford could address the percentage of our community that are getting the vaccinations, and also address the percentage of us who are casualties to this virus is not really put out there. And I think that if we could inform people how we're being affected, I think that would make a difference in them seeking to get the vaccinations. I might be wrong, but that's a vague area. And I think that if she could help us with that, it may help us to inform people about that. Is my question clear?
I think I can kind of take a.
Are you taking notes, Javelle?
Yes, I am.
Okay, it's clear. It's taking a note.
Yes, I can say I don't have any exact percentages right now, but I will say that amongst all of the medical organizations that have been issuing the vaccine, a very common concern is the African American community refusing to take it. So I mean that's something that everyone is kind of focusing on right now. And like I said, I can get back with you about actual percentages, but I can say from my experience and from some of the conversations that I've had that, I mean, definitely us as African Americans, we are really leaving here when it comes to COVID. So it's very necessary that we get this vaccine.
Absolutely. Here's a question for Pastor Dogan. What has been the reaction in your congregation in respect to receiving the vaccine?
So with my specific congregation, they have been very, very willing to get the vaccine. And my pastor even got the vaccine and did a robocall to all of the members and said, hey, I got the vaccine. I feel fine. You all need to get it too. And because my congregation knows I work for Dhec, I'm on the phone with people at all times of every day asking me questions about where they can go and what they will experience and things like that. So they've actually been, ready and willing. But then again, my congregation is made up of a lot of senior citizens. So, not only do they want to be protected because they are, senior citizens, they've actually lived through other things where they can see the value of a vaccination.
Thank you. Pastor Dogan, the question is for you as well. What's the reaction in your congregation with respect to receiving the vaccine?
Yes, and I sent Carmen a private message as well, but I'll be glad to share with the audience. One is that people are excited that the vaccine is available. I think people are ready to come together, congregate again, and doing the things that's necessary. Others are having a hard time because they have little or no computer experience. And so trying to sign up online was a challenge and a barrier. And so we have those who can help with that. And I know other pastors are running into that same predicament as well. And then the eagerness of wanting things to be available to them, different age groups or different levels to be opened up. The last thing I'll say is when it comes to is that there's still a lot of questions. People are still saying, I would love to see the results of the testing. I would like to see more testing done before people make a decision. Some people still feel it's too soon for them. And while it is a person's personal prerogative, my hope is that we will give enough opportunities for education and that people can make an informed decision for themselves.
Excellent. Thank you. All righty. There's a couple more chat questions. Here's some data that's being shared with the group. Blacks are 3.7 times more likely to be hospitalized and 2.8 times more likely to die than any other races. And that comes from Miranda, who's a nurse at Bon Secours. Thank you for sharing that. And then Mrs. Baxter, what is Dhec's plan for outreach in the Black community or in Black communities?
So right now, Dhec's plan is to actually do the boots on the ground, going door to door, talking to the Black community. I'm on the community systems team, so they will actually come to the community systems team and say, hey, you know, where are the Black communities? Where are the communities that we need to be focused on and prioritizing? So we've actually been having that discussion, like I said, going door to door, doing these types of presentations, providing them with education and information so we can prioritize them and get them to come out to get this vaccine.
Thank you. I think that's extremely important and a question that's being raised more and more in terms of health equity, that we need access in African American and Hispanic community. Okay. Are there anything else? Oh, here's a question. If you are in the house with someone who has had COVID, does that give you priority to get the vaccine? I think that's similar to another question earlier.
So that does not necessarily give you priority to get the vaccine, just like even if you've had COVID and it's been within your 90 days and you are eligible to get the vaccine, they will tell you to wait because you have some sort of natural immunity and let that vaccine to go someone else who does not. So it's kind of the same thing with this. If you are in the household with somebody that has COVID, you're not necessarily prioritized because whether you get COVID or not, whether you experience symptoms or not, you probably have some sort of natural immunity built up. But again, like I say, you know, always just check and ask. Because you know.
Thank you. All righty, there's 10 minutes left. Is there any other question burning question that you wanted to ask? And this is your opportunity to come forward now. And if not, then I'm going to thank the audience and Mr. Vell for that great presentation and for those great questions. And I'm going to turn it over to Pastor Dogan.
Well, thank you, Ms. Long and Ms. Ford. Thank you so very much. This information has not only been helpful, but I know that it will be useful to all of our faith leaders. Listen to all the pastors and ministers and faith leaders of different congregations here in the upstate. You are awesome. You have shown up today, and I am so appreciative of it. Listen, I believe that there is power in the pulpit, and that the pulpit is such a powerful platform in order that we can give out information. Listen, I know that you are well versed in the Word of God, but all of these COVID questions still may have you stumped. So I want to let you know of another event that will be coming up really soon that is sponsored by not only the church that I pastor, Lone Branch Baptist Church, but also Secours, and then also we're grateful to have 107.3 Jams and Cox Radio as one of our leading sponsors and those who will help with publicity with this matter. I know the Urban League and I'm sure the NAACP will be a part of getting this word out as well. But it is entitled A Community Virtual Discussion, COVID-19, the Vaccine, and the Effects of the Black Community. I know that Pastor Clark asked about rates in the Black community and others that asked about vaccine rates and also more mortality rates. And so I am sure that at this session, that information will be shared. I want you to know that on this panel, it will be a panel discussion on this panel on March the 11th at 6 p.m. There will be over 5 or 6 PhD medical doctors and medical doctors, nurse practitioners. It will be hosted by our very own Rhonda Rollins, myself, and Melody Samuel virtual, and we are just grateful for the opportunity. Listen, to all of our faith leaders, I want to thank Bon Secours. Listen, it was so not only humble of them, but so open for them. They could have gotten professionals in their own system to do this workshop. And on March the 11th, it will be practitioners from Bon Secours, but I'm grateful that they have led us straight to Dhec. And Dhec is the state agency that is responsible for the COVID vaccine rollout. And I'm thankful because to me, that was them sharing pure information. You know, it's one thing to only toot your own horn. It's one thing to only praise your own pond, but it's another thing to give genuine, true information from an agency that is here to truly serve the public. And so I'm grateful for that. And I want you to know that Bon Secours has their own vaccine rollout protocol as well. And Ms. Long, I don't know if there's information that you can share that Bon Secours can assist residents, especially in the area, or a phone number that people can call, or at least
Absolutely.
To give our faith leaders. So Ms. Long, if you would share that, and then we'll close. We didn't open up in prayer, even though my heart has been praying all day for this event, but we will close in prayer together.
Can I send you that information that you can get out to everybody?
Yes, we will definitely get
I'll do that.
out.
And when I get off the call.
So you will receive an email, especially if you're on the Zoom presentation, if you registered. So everyone who registered will get an email with the information from Bon Secours. To our Facebook family, thank you so much for tuning in, and thank you for sharing this broadcast with others as well. And I am so grateful and delighted that you were a part. Listen, let's pray together. I know we have faith leaders on, and I will be praying in the Christian context. And so I pray that everyone will join me in prayer. Let's pray together. Father, we thank you and we praise you for who you are. And Father, I thank you that with all the names that we have called you historically and even to the present, I'm grateful that your word declares that I am Jehovah Rapha, the God who healeth thee. So Father, with all the names that we've called you, I thank you that you called yourself the healer. And with everything that's going on in our nation, our world, our community that has brought about this public pandemic, I thank you for being the source of all cures. So, Father, we thank you for our time together. Thank you for Ms. Ford. Thank you for Bon Secours. Thank you for the Urban League of the Upstate. Thank you for the NAACP. And thank you for all of our faith leaders who have joined us today. Go with us, stand by us. And Father, we'll give your name praise and glory. It is in the mighty name of Christ we pray. Amen. Thank you so much. Blessings to all.